Welcome to Plus Talk on Plus Life, where we are all about turning positive into a plus. And a man who has been doing that for, well, over 30 years. Dr. Gary Blick is joining me. Doc, you have been there really since day one when it comes to HIV/AIDS. Here we are, 40 years later. We have another pandemic on our hands. Did you think that you would live to see a day when there would be another pandemic to have to deal with?
I don't think I've ever planned to ever live, the day to see a pandemic like this, the one in a every 100-year type pandemic. This is beyond, recognition. It's really surreal.
I've talked to a lot of people living with HIV who are over the age of 50 and entering their golden years of life, especially here in the United States. There is a lot of talk that this is going to become the next sort of health crisis in our country. Those of us living well past what we ever thought we would with HIV. And I've asked them a lot about PTSD and the sort of what this pandemic has done for them as far as bringing back memories. What has this pandemic done for someone like you who was there at the beginning treating patients? Have you had any PTSD?
Well, let me just say, first of all, HIV and aging is already here, and it's already a major, major issue, just because of all the comorbidities people have when they're HIV positive and they live for 20, 30, now, as you said, 40 years with HIV. So the PTSD was enormous when this pandemic started, because it brought back flashbacks of my early days in HIV back in the 80s. And Carl, you talk about the PTSD. I already had 3 of my patients die from COVID-19, and their husbands did not want them to be in the intensive care units alone and isolated and dying by themselves. So imagine in this day and age when you can't see people in the office and you can't visit people in the hospital, to help somebody through death and dying by telemedicine, through video health conferencing like this, it was really, really tough. You're talking about flashbacks to those old days. It was really bad.
Yeah, and I understand that, COVID-19 is a very different virus to the HIV/AIDS situation. 2 totally different things. But
Completely
is there any part of you that gets frustrated when we see how quickly the world has come together and we've got clinical trials going ahead now with drugs and vaccines? And again, I'm not a scientist or a doctor. That's your job. And I know that they're very, very different beasts. But it amazes me that we've rallied the world, and here we are with all these clinical trials that are proving very promising. Yet, we still have not hit that magic concoction, that magic pill that will get rid of HIV.
Carl, I'm a clinical researcher also, as you probably know, so it's not frustrating for me that we haven't hit that magic bullet immediately. It really isn't, because it's brand new, and you've got to have the ability to come up with these therapies. The connection, the bridge between these 2 viruses, honestly, is Tony Fauci. We're just missing ACT UP New York and ACT UP Paris and all the activists who came to our rescue when everybody was dying at this point, But Tony Fauci helped change the entire structure of drug approval and of research, along with that pressure from all my friends who have since died from ACT UP and all those that are still alive, by putting that pressure on people like Fauci and the NIH and the NIAID and the FDA to make these things happen. So when you have something with an emergency use authorization, that happened because of all of our friends that fought and died for HIV to see all of this.
But why aren't we using that towards the cure for HIV/AIDS? Why aren't we fighting that at the same veracity that the world? And I guess what I'm trying to swing around to maybe with this is, back when HIV kicked off, it was very much considered a white gay man's disease. Now, we obviously know that's not the case. But is the fact that this novel coronavirus, just like HIV, can affect everybody, but seems to have swept across the world in a very frighteningly fast fashion, is that why that it's gotten such the attention that maybe HIV didn't get?
Well, it's the here and now infection, Carl. It is the pandemic of the years. And the reason that HIV did not get that attention is you just mentioned it. You know, when I was in medical school and I had just come out of the closet back in 1979 in my first year of medical school. And, you know, when young gay men, you know, of my community at that point were coming into the hospital floors and dying from this unknown virus, remember the first reports of homosexual men dying from pneumocystis carinii pneumonia was really in 1991. So as you say, in 1981. So as you said, we're coming to the 40th anniversary. But because it was considered gay-related immunodeficiency syndrome, grids at that point, nobody was doing anything about it, okay? And then I don't know if you remember this historically, but it went from grids to the 4-H club. You know, we got to come up with acronyms for everything. So the 4-H club was homosexuals, heroin users, intravenous drug users, Haitians, and I was in Miami when all the Haitians were coming in with this, and hemophiliacs. Well, from there, obviously, we discovered it was a virus. We coined the term acquired immunodeficiency syndrome and everything like that. But remember, nobody talked about this during the Reagan years from 1980 until my hero, Surgeon General C. Everett Koop, in 1987, put out on his own a mass mailing to every single household in the United States. To this day, he's still my hero. Surgeon General C. Everett Koop was actually my ambassador at large for my first nonprofit global health organization in the year 2001. And I'm actually opening up a pharmacy in my office suite now that I'm going to be naming after him and honoring him. And I hope to reach out to his daughter and see if she'll be available and healthy enough to come for the dedication of that, the Koop Memorial Pharmacy. But nobody talked about it because it was people who did things that they shouldn't do getting this virus, until it became mainstream and we realized it hit everybody, including heterosexual people. Nobody talked about it. And thank God, C. Everett Koop opened up the discussion.
Isn't it an interesting point also? And then we used fear as a way to really smack people around to get them to wake up to this whole thing. I'm glad we're not using fear now with COVID, but boy, did people sit up and take notice when it was HIV, and it was always wear a condom and say no to drugs and et cetera, et cetera. And yet here we are in 2020, and there are massive dorm room parties happening on college campuses, and people in grocery stores knocking things over because they're being asked politely to wear a mask.
Yeah. That's coming obviously from the disinformation that's out there and everything. But there has been a ton of fear about this virus. Remember when we thought we could pick this up by touching grocery, items and stuff? You had to wash your lettuce after you took it back from the market because you can get it potentially from touching the lettuce. Or if you got a cardboard box delivery, you had to wash it down or just leave it outside for 24 hours, and it could be on plastic or metal for 72 hours. So that was fear. And it's no different than in the early HIV epidemic. I remember sitting in the room of this woman by the name of Dee Dee, and she was dying from HIV, and I would just go in the room and I'd sit with her. And I remember this electrician coming in this entire head-to-toe white suit, looked like the old Zoot suits with goggles on, seriously, to change her light bulb. And I just went, I said, give me that light bulb, and I just put it into her socket just like that. I said, it's all done. You could leave now. And, I went back to holding her hand and hugging her and letting her go with some dignity, because that's what happened. People were isolated like that. And it was no different in the hospitals in New York and New Jersey and here in Connecticut during those first 3 months of March, April, and May of not knowing much about this virus. We've learned a lot, obviously, in the last 6 months, but not really difference when it comes to the two viruses in retrospect of looking at them together like that.
Lastly, because I've only got you for about 40 seconds or less before we've got to wrap this up, as it stands today, what do you want people living with HIV to know about COVID? What's the latest? Any information science updates you can give us?
Yeah, so we know now that just being HIV positive, just from HIV alone, you're not at increased risk of death and dying from COVID, okay? The problem with HIV and aging, as we started out by saying, is people live longer, they get more comorbidities, they get more hypertension, more diabetes, they may be cigarette smokers, they may be overweight. Those things are what put people at risk for this whole thing. But just the last thing I want to say on HIV is it's no different than with COVID. Stigma and discrimination are still the biggest things we have to fight when it comes to all this. That's what's going on in this country. country. That's what's going on in Africa. That's what's going on all over the world with COVID. We're still dealing with that 40 years later with HIV.
Dr. Gary Blick, I wish we had more time. We must do this again soon. Thank you so much for giving us your time. If you want more information on what Dr. Gary Blick and I have talked about today, be sure to follow us at Plus Life Media or go to the website at pluslifemedia.com. Doc, nice meeting you, nice chatting with you. Thanks so much.
Same here, Carl. My pleasure. Have a good night.